Good morning, my good people of Bushenyi. My name is Kemigisha Vianah Kashaya, also known as Nyamunyonyi. I'm a proud daughter of Bushenyi, born in Kakanj sub-county. I have grown up seeing how access to healthcare or the lack of it shaped the lives of families in our villages and towns. I'm trained in public health. I have worked on health and community programs that addresses real challenges faced by our people, especially women and children. I understand how data planning and accountability determine whether medicines are available, health workers are present, and services reach those who need them most. I am offering myself to serve as your woman member of parliament because health leadership must be evidence based, accountable, and people centered. Health policy must translate into functional health centers, motivated health workers, reliable supplies, and preventable care that protect families before illness strikes. Bushenyi deserves leadership that treats health not as a privilege, but as a right for every citizen. Health affects every aspect of our lives, our productivity, incomes, children's futures, and dignity. And we have seen over the last 15 years, Kenya has seen an increase in health facilities, health centers. Many families still struggle to access timely and quality health services. And I'm passionate about healthcare services. I would also want to share a few highlights and achievements from my career in the health sector. My first job after university from Makerere University was at KIU International Teaching Hospital, where I worked in HIV programming. As part of the team, we increased the suppression rates among patients living with HIV who were not adhering to their medication from 57% to 90% in the CHI clinic. Through my effective information systems management, where we achieved a ranking of number 4 in the country and number 1 in the region during my tenure at KIU. I later moved to Churhura district, where I spearheaded health management systems that were vital in guiding COVID-19 control measures. These efforts helped the district excel in health service delivery, moving from position 107 to position 1 in the National Annual Health Sector Performance Ranking. After my success in Churhura, I joined USAID to support other districts in Ankole region, especially in family health. Several achievements were registered. I can still remember. In Rubirizi, we improved immunization coverage for children under 1 year from category 4 to category 1. And I've also supported a number of activities in Bushenyi district, and I think the DHO's office, if contacted, can specifically tell you what we supported, that especially in data management systems, logistics, and supply chain management. And we also managed the personal spearheaded in reducing the error rate from 40% to 8% in data management. And we must also acknowledge the government has invested in the health sector through the Ministry of Health. We have seen grants for primary health care. We have also seen result-based financing grants. But what is happening, most of these facilities, you have seen, I was in Chitagata recently in Chizova, but mothers were telling me that they're delivering from Bugonji. Why should our mothers deliver from Bugonji? Because result-based financing, if you deliver more, you get more funds. So if we allow our mothers to deliver from other districts, means they are the ones now going to be benefiting. So we have also seen government has continued to invest in saving lives of Ugandans. And about almost 721 billions have been dedicated for healthcare supplies, general essential medicines, and drug supply through national medical stores, looking at the financial year 2024-2025. But what is the react on the ground? Personally, I've moved to about 17 sub-counties Despite all these investments, we still see serious challenges of drug stockouts. We still see people raising concerns of drugs not at facilities, and yet we see investments of 721. Personally, I would not want to see, as a member of parliament, my voter coming to health facility and is lacking drugs. And that should be a very big concern for the leaders. I was in Kariango. Mothers were telling me they move all away from Kariango to Chabjimbi, looking at how many babies we are losing. Like, for example, in the year 2022, we lost about 192 babies. Yeah, 2023, we lost about 143 babies. In 2024, we lost about 164, looking at the annual health sector performance report. And these babies, when we look at the most leading cause of death was birth asphyxia, though majority were not reviewed. For the financial year 2023-2024, we saw about 63.3% being reviewed. So it means that even though the government has invested in these facilities, but we still see our babies die while being given birth. And you see the most leading cause being birth asphyxia, and you cannot rule out, could it be the problem of delays from where they're coming from to the health facilities? And this is my biggest concern. I want also to assure voices of health workers and patients are rarely amplified at the national level, yet Parliament has the mandate to demand answers. And as a member of Parliament, I want to assure you, as your woman member of Parliament, I will focus on these actions. I would advocate during the national budget processes for adequate funding for primary health care. We also advocate for RB increased funding. RBF has done a great job. We must applaud the Ministry of Health. It has done a very great job. And also we advocate for more funding for key health programs, including maternal and child health, sanitation and hygiene. I also ensure we monitor and demand accountability from national medical stores to ensure high order fulfillment rates so that all health facilities in Bushenyi receive the right medicine and supplies on time and in full. If it is 40% delivered by NMS, it is my duty as a member of parliament to question the 40%. Why not the 100%? And yet we ask the 100%. Where shortfalls occur, I will advocate for redistribution within the districts and outside the districts and follow up with Ministry of Health for immediate corrective action. And also, I don't want to see a patient, my patient, comes out to the facility and leaves without the medicine due to stockouts. I also raise health service delivery issues affecting women, children, and vulnerable groups until solutions are implemented. I also advocate for new health facilities in Nkanga sub-county, Kizinda Town Council to extend services to underserved population. We still have very many health center tools, Kashaya Health Center 2 in the whole of Vishaka division. I also advocate to be upgraded to a health center 3. We still have Kajunju in Chabjimba at the level of health center 2. I also advocate for Kajunju to be at the level of health center 3. We also have Nyarugote in Nyavare Health Center 2. From Nyarugote to Nyavare Health Center 3, it's a very long distance. I also advocate to be upgraded to Health Center 3. I also collaborate with NGOs to provide better training and facilitation of our village health teams. The VHTs are doing a great job, and it should be a district-led programming. I also applaud the Mayanja Memorial Foundation. It's doing a great job. We're so patterned with them, and we see that our VHTs are supported so much. There is also working with the DHO's office. We shall collaborate with NGOs to facilitate health performance review meetings involving communities and health workers. I do not want to see only the health workers participating in only performance reviews. We must involve communities. True health begins with the community. I will launch, as your woman member of parliament, continuous health programs on malaria, HIV, and lifestyle diseases. While in Parliament, I would advocate for reduction of diagnostic costs, that is a CT scan, MRI scan at Mbarara Regional Referral, to make specialized care affordable, especially for wananchi. While in Parliament, I will also advocate for private-public partnerships that expand community-based insurance and affordable health care for all the citizens. Finally, I'm 20%. So accountability, we must know that as an MP is not a doctor and is not a donor. An MP is a representative and an overseer. I commit speaking for Bushenyi in Parliament, and I must report back to you and ensuring health policies translate into real services for our people. Together, we demand accountability, we demand better health care. Thank you. Thank you so much. May God bless you. May God bless you. Bushenyi. Thank you. Vianah, ra, ta, ah.